No longer will you be forced to isolate if you test positive for COVID-19. It used to be 7 days, way back when it was 14. It was reduced to 5 recently. Now it's 0. So there'll simply be advice to isolate if you're actually sick during that time that you're sick. And otherwise, if you're not symptomatic, if you're feeling okay, you can go to work. It's something a lot of people have been pushing for, businesses, even the Health Services Union and nurses have been saying we need to get people back into work. There's a lot of people, a lot of Australians sitting home with COVID perfectly well who should be at work. So that's the decision today. Pandemic leave as well, incidentally, goes because the government's saying there we were forcing you to take leave, so we were paying you for it. Now that will no longer be the case. Obviously, for people who do have sick leave and they're sick, well, you just get it in the normal way. You've got a cold, you've got flu, you've got COVID, you're homesick, you get sick leave. Obviously, casuals, they don't have sick leave. So that was part of the questioning there. What about those casuals? What will happen to them? I'm sure some will work when they're a bit ill because they need to get paid, and that's going to be the reality of it. The hope from leaders was that, I suppose, wise decisions will be made. There will be a bit of a carve-out. So people in aged care work, for example, in some healthcare settings, will still get pandemic leave. From what we heard there, it's not entirely clear, though, whether or not they're forced on leave or not. It seems as though they won't be forced to take sick leave, but they'll be offered the pandemic leave, i.e. if they're sick, why not take the sick leave? So that seems to be the solution there. So a significant day, COVID isolation, just repeating, will be scrapped. Mandatory isolation, that is, from October 14. Let's go to our senior political reporter, Trudy McIntosh. Trudy, I thought what was interesting as well is we heard there from Anthony Albanese and from Paul Kelly. This didn't go to the specialist expert advisory group. It was simply Paul Kelly asked for his advice. He gave it back to Anthony Albanese the night before National Cabinet, as in this happened yesterday. I'm not saying that's the wrong thing, but it was obviously maybe a keenness just to get this done and not set it off for a few weeks for a few experts to argue about it.
And they knew, Tom, that this proposal was going to be brought up one way or another. The New South Wales Premier, Dominic Perrottet, front-running this time yesterday, very publicly saying at a press conference in New South Wales that he would be raising this issue. We thought this morning, but the deal appears to have been stitched up last night at that private dinner at the Lodge, the Prime Minister sitting down around the dinner table and having this discussion with state and territory leaders, relying on this advice, though, from Paul Kelly, Australia's Chief Medical Officer. It actually has been released publicly. We haven't, up until now, very rarely seen the actual medical advice released publicly, but the 3-page document has been made public. I'll just run through the top line here of what we have seen today in terms of what's going to happen going forward. October 14, so just a few weeks away, you will not have to isolate if you test positive to COVID-19, but the very, very strong recommendation coming from the Chief Medical Officer and the Prime Minister is if you're feeling sick, stay at home. Pandemic, the payments, as you said, has also been scrapped, coinciding with that date. They're not ruling out, though, the need to bring it back down the track if we do see a big outbreak or a new variant. There was some confusion about what's going to happen if you work in a high-risk setting. So if you're in aged care or a healthcare worker, you will be able to still get access to this payment. And there will be a discussion potentially with employers around the country as to exactly what their advice will be to their own staff, for say if you're working in an aged care centre. And all of this will be reviewed in December when the National Cabinet meets again. Let's take a look at the Chief Medical Officer, Paul Kelly, though, explaining why he's made this advice now to remove isolation.
Isolation itself cannot be seen in isolation. It needs to be seen in the context of that high vaccination rate, high previous infection giving further protection, the availability of treatments, the availability of vaccines, including the new bivalent vaccines, and all of the other measures we have in place, particularly to protect vulnerable people close to where they are. It's time to move away from COVID exceptionalism, in my view.
So the change has happened. Look, I think in reality, many in the country had sort of moved on from this anyway, and it's just become official now. Health funding is a big one, Trudy. A push from the states and also territories to get more from the Commonwealth amidst a groaning federal budget. What did we hear about that?
Well, the Prime Minister continuing to keep his position reserved, really. They're not saying whether the states will eventually get their way in terms of changing up this funding mix. The states have been pushing for the Commonwealth to go 50-50 in terms of hospital funding. At the moment, the agreed split is 45% for the Commonwealth and 55% for the states. During the pandemic, that shift had changed, but the agreement is going to expire at the end of this year. The price tag of going 50-50, it's been estimated, would be $20 billion for the Commonwealth over the space of 4 years. It'll be a big hit to the budget, which is already having to make tough decisions given the level of debt that we're seeing. This is the Prime Minister, though. Quite a funny moment. He's not the first Prime Minister to face these sort of calls coming from state and territory leaders. He made a pretty big joke about this as he delivered the answer.
I can tell you that what they would like is more money.
Okay.
Why stop at 50? Anyone here want 80?
Yep. On that.
You know, it's an ongoing debate which is there. I've stated very clearly my view.
So Tommy, you might want to be a little bit careful there asking premiers if they'd want an 80% funding split. I'm sure plenty of them very happy to take that up, but it'd be a massive cost to federal taxpayers.
They'll be crunching the numbers right now. Trudy, thank you. So there you go. COVID isolation, enforced isolation, as you see on your screen, gone October 14.